Are you tired of chronic lower back pain, limited mobility, and radiating discomfort because of sacroiliac joint pain or sacroiliac joint dysfunction? Sacroiliac joint pain can significantly impact daily lives, causing persistent lower back pain, hip pain that worsens with movement or prolonged sitting. This type of pain often radiates down into the legs, mimicking sciatica, and can lead to reduced mobility and overall discomfort. In this video, you'll gain a better comprehensive understanding of what sacroiliac joint pain is and how to better properly diagnose it and evaluate it, as well as discover one of the most safe and specific treatments that can bring you instant lasting relief. But that's not all. Stay with me until the end to discover easy to do exercises that you can perform to further relieve your SI joint pain and discomfort. Welcome to World Class Chiropractic's official channel. I'm Dr. Peter Turner, one of the dedicated chiropractors at World Class Chiropractic here in Ellicott City, Maryland. Our mission is to help you achieve your health goals, whether that's reducing pain, improving mobility, or enhancing your overall well-being. At World Class Chiropractic, we specialize in treating conditions such as lower back pain, sciatica, neck pain, upper back pain, shoulder and arm pain, headaches, and more. Our expert team is committed to providing top-notch care and personalized treatment plans for each patient. Before I dive in, be sure to subscribe to our channel if you want expert tips, effective strategies, and practical guidance to help you live a pain-free, healthy, and fulfilling life. We upload a new video every week. Why is SI joint dysfunction so painful? The sacroiliac joint, located between the sacrum and the ilium bones, bears significant weight and stress during movement. Dysfunction in the SI joint can lead to inflammation, limited mobility, and irritation of those lower lumbar nerves, resulting in intense pain that can radiate through the lower back, buttocks, and legs. The problem is SI joint dysfunction is often misdiagnosed and therefore mistreated, leading to chronic pain, disability, worry, and frustration. The sacrum is such an important part of the spine because it serves as the foundation of the entire spinal column. It supports the weight of the upper body and connects the spine to the pelvis, playing a crucial role in maintaining stability of your spine and posture. The causes of SI joint dysfunction are varied and can include traumatic injury, arthritis, bad posture, pregnancy, uneven leg length, and repetitive stress from activities such as heavy lifting or prolonged sitting. Getting a proper diagnosis is the first step to receiving the most appropriate treatment. When you come in with a symptom of lower back pain, hip pain, or radiating leg pain, an important first step is a thorough consultation and examination. We start by discussing your medical history and the symptoms you're experiencing, diving deep into the symptoms you're experiencing, such as looking at location, duration, and severity of the pain, as well as looking at possible causes and the activities that both exacerbate or alleviate the pain. This allows us to get a better understanding of what is happening in the body. Palpation of the spine, the SI joints, and surrounding areas is another important aspect of our examination. This involves using our hands to feel the structures of the body to detect abnormalities, pain, and other signs of dysfunction. By doing this, we're able to locate the areas of local tenderness and pain, detect inflammation and swelling, and most importantly, assess the alignment and mobility of the joints. Visual examination, including assessing range of motion and posture, allows us to note any areas of restricted or painful motion, or areas of abnormal spinal curvatures or postural displacements that may be affecting the SI joint. Along with palpation and visual exams, it's important to perform specific orthopedic tests to help differentiate SI joint dysfunction from other sources of low back or hip pain. These tests provide crucial information for accurate diagnosis and effective treatment. Now let's talk about X-rays. X-rays are an essential part in diagnosing SI joint dysfunction. They allow us to see the alignment of your spine and SI joint and identify any structural abnormalities such as arthritis or degenerative changes. We often take full spine X-rays, and here's why. Misalignments or postural displacements in other parts of your spine or body can significantly impact the sacrum and SI joints. A full spine x-ray allows us to see the bigger picture. For instance, if you have a misalignment in your neck or mid-back, it can create compensatory changes down your spine, affecting the pelvis and SI joints. By examining the entire spine, we can identify those issues and address them holistically. Misalignments in one area of the spine can lead to a chain reaction of problems. For example, if your lumbar spine is misaligned, it can cause that pelvis to tilt or rotate, putting undue stress on the SI joints. This is why we emphasize the importance of full spine health in diagnosing and treating SI joint dysfunction. Now let's talk about treatment. Some treatments like medication or injections and sometimes other forms of therapy often fail because they are not designed to discover and treat the root cause of SI joint pain. The risk with this is that SI joint related symptoms, low back pain, hip pain, and leg pain can become chronic and lead to further prolonged disability. That's where chiropractic is different. Chiropractic focuses on identifying the root cause of the SI joint pain and has a proven track record for correcting SI joint dysfunction and permanently relieving SI joint related pain. Once we've confirmed the root cause of the pain that you're experiencing, we proceed with chiropractic adjustments. The goal of these adjustments is to restore proper alignment in the joint and movement into the joint, as well as remove interferences and take pressure off of those nerves. We use precise and controlled forces to gently move the SI joint back into its proper position. The adjustments are tailored to each patient. For SI joint issues, we often use techniques that involve gentle thrusts or pressure applied through the pelvis or sacrum. These adjustments are designed to be both safe and effective. Chiropractic adjustments are safe because they are non-invasive and are performed with great care. We use minimal force and always ensure that the patient's comfort. These adjustments are highly effective because they target the root cause of dysfunction, providing relief from pain and improving joint mobility. Along with the chiropractic adjustment, it's also very important to include these specific exercises and stretches into your treatment. Stretching helps maintain flexibility and reduces tension around the SI joint. When the muscles and ligaments around the joint are flexible, they can better support the adjusted SI joint, preventing it from slipping back into misalignment. Regular stretching can also alleviate muscle tightness and improve overall posture. Strengthening exercises are crucial for building the muscles that support your SI joint and spine. When these muscles are strong, they help stabilize the joint and reduce strain and prevent future injuries. Core strengthening exercises in particular are beneficial because in a strong core, that supports your entire lower back and pelvis. When you combine chiropractic adjustments with stretching and strengthening exercises, you are addressing both the structural and functional aspects of the SI joint dysfunction. Adjustments correct misalignments, while stretching and exercises ensure that the muscles and ligaments can support the adjusted joint properly. This holistic approach not only speeds up recovery, but it also helps stop future issues. Now, here's your bonus tip. I'm going to show you 4 easy stretches and exercises that you can do at home that can help stabilize the lower back, the SI joint area, relieving lower back, hip, and leg pain. The first exercise is the pelvic tilt. This exercise helps strengthen the muscles supporting your lower back and pelvis, providing better stability for the SI joint. To do the pelvic tilt, lie on your back with your knees bent, feet flat on the floor. Flatten your lower back against the floor by tilting your pelvis up slightly. Hold this position for 5 seconds, then relax. Repeat this 10 to 15 times. This exercise helps engage your core muscles and stabilize the SI joint, reducing pain and improving mobility. The second stretch or exercise we're going to show you is the knee to chest stretch. This stretch helps relieve tension in the lower back and gluteal muscles, which can reduce stress on the SI joint. To perform the knee to chest stretch, lie on your back with your knees bent. Bring one knee towards your chest, holding it with both hands, keeping the other leg bent or straight on the floor. Holding this stretch for 20 to 30 seconds or 5 to 8 controlled slow breaths Then switch legs. Repeat 2 to 3 times on each side. If you have difficulty initially holding your knee with both hands, a towel behind the knee is a great option as well. Use the sides of the towel to bring the knee to your chest. This stretch helps release the tension and tightness around the SI joint, promoting relaxation and flexibility. The third exercise is the cat-cow stretch. This exercise provides spinal flexibility and helps align the pelvis, which is beneficial for the SI joint. To do the cat-cow stretch, start on your hands and knees with your wrists directly under your shoulders, knees under your hips. Begin with the cow position. Inhale, arch your back, lift your head and tailbone towards the ceiling. Then move to the cat position. Exhale, round your back, tuck your chin towards your chest and your pelvis to the floor. Continuing moving between these positions for 10 to 15 repetitions following your breath. This exercise helps improve the flexibility of your spine and pelvis, reducing the tension of the SI joint. The final exercise is the clamshell. The clamshell exercise targets the gluteus medius muscle and other hip stabilizing muscles. Strengthening these muscles helps reduce the strain on the SI joint, promoting stability and reducing pain. To do the clamshell exercise, lie on your side with your knees bent at 90-degree angle and your legs stacked. Rest your head on your lower arm. Place the top hand on your hip to stabilize your body. Keep your feet together and slowly lift your top knee as high as you can without rotating your pelvis or moving your lower leg. Hold the position for a couple of seconds, then slowly lower your knee back down. Repeat this movement 10 to 15 times on each side. Make sure you keep your core engaged and your pelvis stable throughout this exercise. This ensures that you're isolating that gluteus medius muscle and other hip muscles effectively. You now have a comprehensive guide for understanding the anatomy of the SI joint, the causes of SI joint dysfunction, and 4 great exercises for the SI joint, and how chiropractic can be a game changer to treat and stabilize the SI joint area. If you have been suffering from SI joint pain and have tried various treatments without success, consider chiropractic care. Look for a chiropractor in your area who has a proven track record in treating and correcting SI joint dysfunction. Now, I want to hear from you. If you've been suffering from SI joint dysfunction, tell us what you've done for it. What has worked for you? What has not worked for you? Leave a comment and let me know. If you found this video and the exercise is helpful, be sure to like and share it so others can learn about this as well. Also, go ahead and subscribe right now if you want to learn more ways to enjoy a life free from pain and filled with health and joy. The next video that you should watch is this one. This video will show you our world-class icing protocol that has been effective in helping my patients not only decrease SI joint pain, but will help facilitate healing. Go ahead and watch this video next.